Ulnar nerve arises from the C8 and T1 nerve roots from the medial cord of the brachial plexus. It has no branches in the arm and also in the axilla. In the arm, it lies medial to the brachial artery, and in the proximal 2/3 and distal 1/3 of the humerus, it pierces the medial intermuscular septum and lies behind the medial epicondyle. It does not give any branches in the arm. It starts giving branches from the forearm itself. It reaches the forearm by passing between the two heads of the flexor carpi ulnaris muscle, and it lies superficial to the flexor digitorum profundus muscle. As the ulnar nerve passes behind it, it may be compressed or irritated, and it's a common site of injury. The ulnar nerve travels through a tunnel of tissue called the cubital tunnel under the medial epicondyle. In the forearm, the nerve gives branches to the flexor carpi ulnaris and medial half of the flexor digitorum profundus muscles. In the forearm, the ulnar nerve runs between the flexor digitorum profundus medially and the flexor digitorum superficialis laterally. It stays medially above the flexor digitorum profundus and under the flexor carpi ulnaris muscles, and also gives branches to them. In the lower part, the ulnar nerve lies lateral to the flexor carpi ulnaris and medial to the ulnar artery. In the wrist, the ulnar nerve passes superficial to the flexor retinaculum and under the physiohamate ligament called the Guyon's canal. At the wrist, the ulnar nerve lies lateral to the pisiform bone. Here, it gives branches into superficial and deep branches. The superficial one supplies the palmaris brevis muscle and also gives medial 1½ fingers cutaneous supply. The deep branch of the ulnar nerve innervates hypothenar muscle and the medial two lumbricals, intraossei adductor pollicis and flexor pollicis brevis. It also supplies all the intrinsic muscles of the hand except the lateral two lumbricals, which is supplied by medial nerve. The appendice digiti minimi, flexor digiti minimi, abductor digiti minimi. These are the three muscles of hypothenar eminence supplied by ulnar nerve. The third and fourth lumbricals, palmar and dorsal intraossei, adductor pollicis muscles, and the deep head of flexor pollicis brevis, sometimes also supplied by ulnar nerve. The ulnar nerve provides palmar and dorsal sensory innervation to the little finger and half of the ring finger, both dorsally and in the palmar aspect.